The adrenal glands, those are the glands that are found right on top of the kidneys. They are also known as the suprarenal glands. They sit on the top of the kidney just like a cap. The hormones are secreted from two different parts of the gland. There's an adrenal medulla and there's an adrenal cortex. Right here is the structure of the adrenal gland. You can see here that is the cap that lies right on top of the kidney, and it's made out of the cortex and the medulla on the inside. On the outside, you will find a capsule made out of connective tissue. The adrenal cortex is the outer portion of the gland, while the adrenal medulla is the inner portion of the gland, and that secretes the epinephrine and norepinephrine. So you can see here the medulla with the chromaffin cells, and these are the cells that release 80% epinephrine and 20% of norepinephrine. As for the cortex, it's made out of 3 different zones. The outermost zone is known as zona glomerulosa, and that produces aldosterone and other mineralocorticoids, and those are related to sodium and potassium levels. So you'll find that your zona glomerulosa are all related to salts or minerals, and that's why they are known as mineralocorticoids. The most common or the most famous of them is aldosterone. The middle zone is called the zona fasciculata, and that produces cortisol and other hormones that are related to sugar levels, hence we call them glucocorticoids. The inner zone is the zona reticularis, and that produces male sex hormones. Whether that gland is in a male or female, the zona reticularis is going to produce male sex hormones. Now for the actions and the factors regulating the secretion of the hormones of the adrenal cortex. First one, aldosterone. Okay, the factors that regulate its secretion are the potassium and sodium levels, and it's also regulated by the Renin-Angiotensin System, which we'll talk about later on. The action of aldosterone, that it conserves your sodium ions and excretes potassium ions in urine. So I usually try to remember them that it gets rid of the P in the P, excuse my language, where it gets rid of the potassium in the urine. So it increases potassium excretion in urine while it keeps the sodium. So it decreases the sodium excretion in urine. Next is your cortisol, and that is under the control of CRH and ACTH. CRH again from your hypothalamus and ACTH from the anterior pituitary. Cortisol decreases protein synthesis. It increases the release of fatty acids, and it stimulates the making of glucose synthesis from non-carbohydrates. So the liver will take up amino acids and will take up these fatty acids and change them into glucose, a process known as gluconeogenesis. So again, your cortisol will break down the protein into amino acids. It'll break down fat or triglyceride into fatty acid chains, and it will use all of those, the amino acids and those fatty acid chains, in order to make glucose. So these patients would have very high levels, or that would lead to hyperglycemia. So if somebody has high levels of cortisol, that person can become diabetic. The third hormone are your adrenal androgens, and that is stimulated by the ACTH coming from the anterior pituitary, and it supplements the sex hormones from the gonads. It can be converted into estrogen. So using through one enzyme known as aromatase enzyme, that androgen can be changed into estrogen. So what is the aldosterone and the renin-angiotensin system? It's a system that helps maintain normal blood pressure. Okay, the system really has receptors in the kidney. These receptors look for blood pressure, and they look for the sodium ion concentration in the bloodstream or in plasma. So if either one is decreased, so decreased blood pressure or sodium ion concentration will stimulate the kidney to make an enzyme called renin. Now renin will reach the bloodstream, and it will change this protein that is found normally within the bloodstream, known as angiotensinogen, into angiotensin 1. Angiotensin 1, through the action of an enzyme known as ACE, or angiotensin converting enzyme, changes into angiotensin 2. Now, angiotensin 2 circulates and reaches the adrenal cortex, stimulating it to make aldosterone. Now, aldosterone through the bloodstream will go back to the kidney and will make sure that sodium and water are conserved in the body and they are not lost in the urine. So you're bringing your blood pressure back up and your sodium ion concentration back up as well. And through those actions, that will inhibit the kidney from making more renin. For the disorders of the adrenal cortex, if there is not enough aldosterone being made, that is a condition known as Addison's disease. So it's due to the insufficient hormone secretion from the adrenal cortex. And you can see here, some of the signs and symptoms. So it leads to electrolyte and glucose imbalances, dehydration, low blood pressure, especially known as postural hypotension, where their blood pressure is fine when they're sitting, but when they stand up, the blood pressure goes down. Person is fatigued, as you can see this lady right here. They have GI disturbances. Very characteristic is that change in increase in the skin pigmentation, and they also have weight loss. It can be fatal, and the fatality is due to the electrolyte imbalance. If there's too much or hypersecretion of cortisol, that leads to Cushing's syndrome, and sometimes it's due to adrenal tumor, or maybe due to the chronic intake of cortisol. The adrenal tumor could make cortisol right away, or maybe the tumor is in the anterior pituitary, making too much ACTH, and therefore overstimulating the adrenal cortex to make lots of cortisol. The result is muscle wasting, loss of bone leading to osteoporosis. There's also elevated blood glucose levels that can eventually lead to diabetes. Too much sodium retention and water retention, and that can lead to hypertension. Puffy skin, and then the redistribution of the adipose tissue. So you can see here what is known as a moon face. You can see here this is known as a buffalo hump, again due to the redistribution of fat. Here you can see, because cortisol leads to protein breakdown or the decrease in protein synthesis, you can see how these marks are being, or hyperpigmentation in the skin.